After 50, a lot of us fear missing a serious disease, so we start ordering every test just in case. As a doctor, I see how some of those tests create more harm than help. Radiation, false alarms, unnecessary procedures. Today, I'll show you 5 tests many adults over 50 don't need routinely and smarter things to do instead. 1. Whole body CT, just to check everything. Why I avoid it? Big radiation dose and tons of incidental findings that trigger stressful, risky follow-ups. When it can make sense? Very specific reasons your clinician is targeting, trauma, a known cancer workup, etc. Do this instead. Stick to evidence-based screening for your age and risk. Colorectal cancer starting at 45, mammography for women as recommended, and a low-dose CT for lung cancer only if you currently smoke or recently quit and have a significant PAC year history. Talk with your clinician about eligibility. 2. Annual ECG or treadmill stress test without symptoms. Why I avoid it? In people without chest pain or shortness of breath, these tests often produce false positives, cascades of extra scans, and even procedures. When it can make sense? Concerning symptoms, high-risk situations, or directed by cardiology. Do this instead. Control the big 4: blood pressure, cholesterol, blood sugar, and smoking status. These change outcomes far more than screening stress tests in low-risk folks. 3. Carotid artery ultrasound, just to see if there's plaque. Why I avoid it? For people without stroke or TIA symptoms or a bruit, screening rarely helps and can lead to unnecessary interventions. When it can make sense? Neurologic symptoms, a detected bruit, or a plan guided by your clinician. Do this instead. Aggressive risk factor management, BP, LDL, diabetes control, exercise, and not smoking. If your clinician prescribes statins or antiplatelets, take them as directed. 4. Cancer marker blood panels, CEA, CA125, AFP, etc., as screening. Why I avoid it? They're not reliable for finding cancer early in otherwise healthy people and create lots of false alarms. When they make sense? Monitoring a known cancer per your oncology plan. Do this instead. Follow proven screening, colorectal, breast, and for those with the cervix, cervical cancer, on the right schedule for you. 5. PSA for prostate cancer every single year by default. Why I'm careful? PSA screening can lead to overdiagnosis and treatments you may not need. What I recommend? Shared decision-making. Discuss age, family history, overall health, and your values with your clinician. Some men should screen, others should space it out or skip it, especially with limited life expectancy or major illnesses. What to do instead of more tests? Keep up with proven screenings that fit your risks and age. Nail the fundamentals: BP, lipids, A1C, weight, sleep, stress, activity, and no smoking. Stay current on vaccines, flu, COVID, shingles, Tdap, and pneumococcal as appropriate. New symptoms, chest pain, fainting, blood in the stool, or new neurologic changes? That's not a screening problem. Get care now. In medicine after 50, the rule is simple. Start with your risk and your symptoms, then choose the test. Not every scan or blood panel adds years to your life. Some only add worry and procedures. Talk with your clinician and pick the tests that actually change outcomes for you. Save and share this with someone you love. And remember, this is educational, not personal medical advice. If you're having urgent symptoms, call 911.